Okay, now let's have a look at the second topic on globalization. So the direct and the indirect effect of health. I'd like to go back to the previous slide because if you focus how it works, how we can represent the globalization phenomena, you can understand how these have direct effect and indirect effect. So generally, if you see this slide, if you see this picture, the direct effect could be in terms of trading, increasing the flow of raw materials, of goods, of semi-worked goods. But when we're talking about goods, we're not talking about just about materials, raw materials, chemical materials or mineral materials, talking about also the agriculture products. So you can imagine how when you go to the market, to the supermarket, there are almost the 60% of the all agriculture products that come from overseas. So you can imagine how is important, how these affect the health sector in terms of maybe pathogen disease that can be travel with, for example, with a fruit or vegetable that moving from one continent to another one. So we had from the trade point of view a direct effect on the products and goods, also on the agriculture, all the agricultural goods. But at the same time, we have all the indirect consequence of this trading because they can increase the pathogen. There are different countries that using different sort of pesticide in the agriculture sector. So there are some countries that not allow, for example, the use of some chemical materials for the agriculture sector. That's the reason why the indirect effect is the fact that in some way we can import not just the goods, but also we can import some pathogen that can affect the health of the citizen that live in a country that import these products. So that's very important that you understand the correlation between the trade and the risks associated with all the products that are imported or exported. So each country has different regulation, especially the regulation in terms of protecting the health of their nation. So let's have a look at the first direct and indirect effect on health. So the increase in pathogen flow. So whether it's the risk of drug-resistant tuberculosis, for example, or pandemic influenza, the movement of people means that the transport of pathogen. So as soon as millions of people every day moving from one country to another one, this increase exponentially the risks that this pathogen or drug-resistant, for example, tuberculosis, can affect the entire globe. For example, the SARS was a wake-up call to a somnambulant public health community and a spark for a new international health regulation and multilateral health collaboration. So the global trade is another ancient vector of disease, pose other health risks from a spread of pests and to that of pestilence. So you can imagine how all the movement of the last, especially the last 30, 40 years, how they can increase the risks of this pathogen, of these, such as the example, using the example of SARS, how this can affect not just the country when maybe was born the risks of the health, but also affect all the people that traveling and can move this pesticide or can move this, for example, the SARS from one country to another one. So this is the direct effect could be inside one nation, but the indirect effect is the fact that this pathogen can flow from one country to another one. At the same time, there are also the indirect effect is the increasing information flow. So the advances in computing and telecommunication have shaped modern, of course, globalization. They also contribute to the globalization, the technological, the IT systems, and also the increasing the spread of health knowledge and technological innovation to reach multinational firms and the rise of contesting social movements. But despite the global spread of interconnectivity, access to information superhighway remains highly skewed. So the information, the digital information, and increasing a lot and in some way amplify the globalization in terms of trade. But if we see from the health point of view, also have some positive effect in terms of also spreading the knowledge and the technological innovation. For example, to the development country, there may be in terms of research and development, they remain behind the Western countries. So this is an indirect effect, but a positive effect. So it's important that you understand that when we're talking about globalization, we are not talking about only the negative effect. In this sample is a very positive effect because we can share the information, we can share the knowledge in terms of increasing the protection, reducing the risks, increasing also the way how we can treat some disease. So that's in some way the digital technology in terms of spreading information represent a very indirect positive effect on the worldwide health sector. So most people, for example, in high income are connected, but scarcely in basically 1% on the African countries. So where the cost of broadband access unjustified for per capita income can be 160 times greater than, for example, United States. That's in some way represent a very negative barrier, because it's true that we can, with the globalization, increasing the share of knowledge. But there are, as I put here as an example, there are several countries, for example, in Africa, where are very scarce connection with a broadband with a high income country compared to the high income country, and also is not justified the cost compared, for example, to the United States, that can be 170 times higher. So one of the biggest barriers in a very poor country is the fact that even if the globalization increasing the share, the flow of information between or among different rich countries to the poor countries such as African countries, for example, they represent a big barrier. A big barrier because it's very costly and there is a very low share of institutions and people that can be connected through the broadband. Increase the trade flow, as I said before, the accelerated flow of trades, goods and services enabled by economic integration has created a new source of wealth and health for someone. Of course, this share of information plus the fact that several new goods and services can be traded among different rich countries has created in some way a benefit. But the problem is that the pattern of production and the exchange, along with the labor market change, have left many vulnerable to employment insecurity, insufficient health and safety protection, and environmental degradation. The typical example is the fact that there are several multinational companies that they move their power plants, their plants in poor country where, of course, the cost of employment is maybe 10, 20 times lower than, for example, a United States or EU country. So in some way, because they choose this specific country, most of the poor country have a very low regulation in terms of health protection, in terms of environmental impact, and this indirectly create a negative impact on the country where these multinational companies are investing. There are several examples. For example, the Coca-Cola, there was a very disputed, for example, in India, close to Kerala, where the production of Coca-Cola reducing the water to the whole rural area by the 90%, because there was no regulation in that region in terms of the supply of water. So there are some positive aspects, for example, increasing the number of jobs when the multinational company moving to another country because they pay less the employer. But at the same time, this can create indirectly some negative effect on the health of the people in terms of, for example, risk to the employer that are in contact with hazardous material. They create environmental impact because maybe there are very low or scarce environmental regulation, and this is in this case represent a negative impact. But because we are focused on the health sector, you can imagine how the risks that, for example, that employer that work in a poor country, where they move into a different country, they can spread disease maybe because they are working in a very dangerous place, because there is no regulation, no control in that country, and from the health point of view, these represent a risks, especially when the people moving from one country to another one. And also, in addition, the energy requirement of global production chains and fossil fuel used in transportation are now among the fast-growing sectors that contribute to climate change emission. So the fact that millions of people every day moving from one country to another for travel, for holiday, or anyway for working, of course, they're increasing the demand of oil. At the same time, they're also increasing all the environmental correlated issues such as climate change, such as ozone depletion, and all the CO2 increasing emission in several countries. This represent an indirect effect, and the climate change and emission represent a very risk. There are some urban areas in Asia where now we account thousands of people that died every year, caused by the pollution, the air pollution. So this represent a very risk for the health of the people that live in this polluted area, that was generally caused also by this tremendous increase in trade of goods and services that was promoted by the globalization phenomena. They have also the increase in financial flow. So the foreign direct investment and the more recent rise in outsourced contract production have reorganized the production across national borders in the process of creating a genuinely global labor market that increases economic inequality and insecurity for many workers. That's the case that I presented before. So there are millions of people that now moving from country to another country because maybe there are more job opportunity. At the same time, they create also some inequality. When we're talking about inequality, we're talking about the fact that there are some regions where the salary maybe is 10 times higher than another one. So this creates a huge flow of migration from the poor country to the rich country. And directly and indirectly, this affects also the increasing of the risks of all the correlated health disease and pathogen that can flow during this movement, this migration of people. So that the foreign direct investment flows have now been dwarfed by short-term financial flows, with a far-reaching consequence not only for health but for the power to implement policies that protect and enhance the health. Of course, there are several big multinational companies that now they have so much power. Sometimes they have a stronger power than the government of poor countries. So they decide to implement, to develop their supply chain, their supply production, and in some way they can protect and enhance the health protection of the employer, but in some way they continue to operate with a very low scarce protection to the risks to their employer. So the fact that this financial direct investment flow to one country to another one in some way is a good aspect in terms of economic development, but there are several multinational global companies that are investing with a purpose only to create a profit and continue to leave their employers, especially when they employ the local people, with a high risks in terms of hazard, in terms of infection, and so on. So there are some direct positive effect in terms of increasing investment in this country, but we have several companies that doesn't respect the same rules that respect in their own country where they have their headquarters, because they prefer leave the workers with less regulation because they cost less. So there are several connections between the trade, the international trade, between how these multinational companies operate in one country and different country, but we have to focus attention on how the health risk should be managed to reducing the risk, especially when the people moving from one country to another country. And there is also the increasing people flow, as we said before. So the migration, long and defining future of globalization and pursuit of greater opportunity is driven increasing by the economic and environmental necessity. So the rich country borders remain open to the best and the brightest, but are revolving doors for workers with a limited credentials, especially in the wake of the 2009 global recession. So in some way, the rich country prefer to invest because, of course, it's much more, the cost is much lower compared to the cost of the employer to invest in different countries, but at the same time, they increasing the regulation that in some way the poor people have less access because they can meet some requirement to moving from poor country to rich country. So there are a different way how we can see the globalization. The globalization in that way represent an opportunity for this company in terms of increasing their profit, because of course they prefer to move in their production, their supply chain in a poor country, but at the same time they don't close the border, but they impose very restrictive rules and regulation to the people that come inside their countries. So that's all the correlation that exists between the trade, the flow of people, the migration pattern, and also the risks of the health on the healthcare systems.